Hello and welcome to the Moral Medicine channel. My name is Eric, and over the coming weeks, we will be featuring a number of sufferers who have taken lion's mane, saw palmetto, and Accutane, and as a result are dealing with symptoms which clearly overlap with those experienced by post-finasteride syndrome sufferers. We hope this video testimony will shed light on the wider issue of post-endocrine disruption syndrome. Our community desperately needs research into this horrific condition in order to chart a path to therapeutics. Please consider supporting the PFSnetwork.org.
So basically, my story is, 4 years ago, I shaved my head now, but my hair started to thin out a bit. I came across the herb called saw palmetto extract, which is a herb that's been used for prostate problems, and it's believed to be a 5-alpha reductase inhibitor and anti-androgen. I thought, this stuff's natural, it should be fine, And a couple of weeks later, I started to feel a bit off. I had some pain in the testicle area, my libido was lowered, felt a bit tired, and, I thought, this is probably just some sort of coincidence. Months later, I started to feel really, really off. Just spaced out, sort of. I started waking up tired, my libido was low, which is very unusual for being young, and I thought, maybe it's a saw palmetto affecting me. I'll just quit the stuff and I'll go back to normal. So I quit it. Huge sense of well-being, libido. My skin was extremely oily, had so much energy. I broke out with acne from all the androgenic activity, I suspect, and sort of said, thank God. I didn't even realize how much it was affecting me until I got off it. 2 weeks later, I started feeling ill one night, and I went to sleep, just expected I'd feel fine in the morning. And I woke up and it was like my physiology had done a completely, 180-degree turn. Last thing I noticed was the brain fog. I just couldn't navigate through my thoughts and really, really spaced out. The second problem was sexual side effects. My libido was basically nuked down to zero, and I basically felt like a monk. The other thing, my motivation was down to zero. Emotions were basically very, very low. Energy was another huge thing. After this, I started waking up every day with just zero energy. It felt like I hadn't even gone to sleep. My sleep was very light. A lot of joint pain. My ligaments became lax. This crash I went through was basically identical to the finasteride crashes. I thought it would go away. I waited a few weeks and it didn't get better. I adapted to being a different person, and I started looking it up, and that's when I came across thousands of people that had post-finasteride syndrome, or PFS for short, and they basically, it was like I'd found, my twin brother or something. And this was quite frightening, seeing so many people going through the same thing, and who would have thought that a cosmetic treatment could cause so much damage?
Hello and welcome to the Moral Medicine channel. Today I'm joined by my friend and fellow sufferer Imran, who is going to be talking about his horrific ordeal with post-finasteride syndrome induced by the supplement saw palmetto. Thank you so much for joining us and for your courage speaking out about this, Imran.
Hey, it's my pleasure, brother. You guys are doing great work, and somebody has to speak out about what's going on.
Absolutely. We appreciate it. So, Imran, I think it's very important for the audience to get a sense of your background since you are yourself a doctor. So I'd love to just hear a little bit about your background.
Sure, no problem. So like Eric said, he introduced me. My name's Imran. I'm 34 years old. I'm actually a practicing anesthesiologist. I'm board certified in general anesthesiology. I went to undergrad at University of Michigan. I did my medical school at Georgetown University. I did my anesthesiology training at Harbor UCLA in Torrance, California. I just graduated in 2019, passed my boards in 2021.
I'd love to know a little bit more about, what prompted you to take saw palmetto. I believe it was just, if I'm understanding correctly, it was just a generic multivitamin that you took, and it happened to contain saw palmetto. And when you took it initially, you weren't even aware that it contained saw palmetto, right?
Exactly. So, I decided I just want to take a multivitamin for my general health. I ordered one of the top-rated multivitamins. It was a men's multivitamin. So saw palmetto was often included in men's multivitamins because it's for prostate health. And I got to say, that month that I was taking the multivitamin, my libido was out of control.
Hmm.
I had an out of control libido. I had increased sexual function for a month to the point where I was like, something is happening. I thought maybe, oh, it's good. I optimized my health. But then I experienced what people call a crash. So all of a sudden, I became completely impotent and had genital numbness. So I had no idea about that this supplement could cause it.
So I want to know a little bit more, Imran, about what exactly happened when you stopped taking saw palmetto, which was in this multivitamin. So you essentially you ordered this multivitamin on Amazon. It shows up. You start taking this multivitamin that contains saw palmetto, and then I'm assuming that if I'm understanding correctly, you ran out of the multivitamin, you stopped taking it, and then you experienced this quote unquote crash. Could you walk me
Right.
through that? So how many days roughly? Obviously, it was a while ago, but could you just walk me through the timeline?
Sure. So, like you said, it was a while ago. So I'm going to try to remember the details the best that I can. And also, like I mentioned, I had no idea that this happened to me from saw palmetto until like a year and a half later. Basically, I took the multivitamin for about a month. And like I said, I experienced no negative side effects. I actually noticed an increase in libido and sexual function for that month. And suddenly, uh, I actually had stopped taking it, because I wasn't disciplined about taking pills. So, I just kind of stopped taking it on a whim. I didn't take it for about 5 days or whatever. But, just a couple days after stopping to take it, I had this sudden crash. And after I crashed, I first experienced the sexual dysfunction. Okay, that was the most upsetting thing, and that's what I was hyper focused on because it was so. As a young guy, to lose that, I think any guy would go crazy, right? Like I did. But then, as time went on, I noticed that I had all these other symptoms, like the anhedonia. Like I suddenly couldn't tolerate food anymore. I couldn't sleep through the night. And maybe you could say that's from acute stress, from losing your sexuality. But this persisted for about a year, and they were very real physical symptoms. And I actually tried to get more sunlight and go do stuff, and I actually went on a couple of vacations with my family. I went to Turkey, and if you look at photos of me early on after that crash, I look like a different person. Like my eyes are sunken in. I couldn't sleep. I looked like a different person. I couldn't even talk. You know, I felt so like shocked about what had happened to me, and I had no idea what happened. That I was completely shook. I had no idea what had happened, and I'll never forget those times. I mean, it's traumatic. So with the sexual dysfunction, just to be a little more detailed, so impotence, genital shrinkage, loss of libido. I had a very high drive. Okay, I was very attracted to women, and I don't remember what that feels like. To have that same level of attraction. So I completely lost my libido. And those were the initial symptoms that I was focused on. And then as I spent time in my new body, with this condition, I noticed that I had an intolerance to a lot of foods that I had no issue with before. So I had to eat very clean. So I couldn't have gluten or dairy or even sugar anymore. I had to kind of avoid like these quote unquote inflammatory foods, which I always kind of thought, oh man, that's BS, like, all this stuff like about inflammation, gut inflammation, I can eat whatever I want. Suddenly I couldn't eat anything, and then I also had severe insomnia. So I would get in bed, toss and turn, not be able to sleep. And finally, when I did fall asleep, it's almost like an on-off switch. It's not like that restful sleep. It's not like, when after a long day, you're tired and you pass out. I don't feel that feeling anymore. I kind of just get in bed, I close my eyes and I fall asleep. It's like an on-off switch. So started experiencing insomnia, which like I said, got better. And then, like I said, the anhedonia, just losing the ability to enjoy anything, and that causes you to isolate. And I just didn't feel like myself anymore. I lost my emotions. I was a very emotional guy. For better or for worse, I was always very emotional. And in my opinion, emotions give color to life. You need your emotions to like write your own story. It's life is so beautiful. There's ups and downs. There's depression and there's joy. There's love and hate. You have to be able to feel those things because that's what makes life beautiful. And even the negative emotions, negative emotions have a purpose. They can be motivators. If you feel guilty or you feel anxious, it makes you think that, maybe I got to reconsider something in my life, or maybe I should be doing something else. They're motivators. We have emotions for a reason. And to lose them completely, you feel like the rug gets pulled out from underneath you and you got no idea. You're like in a new body. And, people always tell me that I appear normal and I look totally healthy. And it's because I put in extreme effort at the gym with lifestyle, optimizing my health. I take it seriously because I'll do anything to get better. And I lost something that I thought I could never lose. I never thought you could lose it, especially at my age. I mean, this happened to me when I was 31. I'm 34 now. So I never realized that you could lose this. I never learned about it in medical school. When I talk to other specialists, I'm actually friends with some dermatologists. 3 of my good friends are dermatologists, and they put patients on finasteride, right, for hair loss. And I told them, I was like, and even Accutane. I was like, of course, I told everybody in my network, I said, first off, don't take any of these medications. And if you're prescribing these medications, you got a responsibility to let patients know that this can happen. That you can have long-term side effects that persist after stopping the drug. And, we have a responsibility to let people know. And I'm letting you know now, that I'm going through it and me. So to let people know. And, people have different responses, but in general, I found that people were not really aware about this. It's something that's just not well known. So that's why I think it's our duty to speak up and let people know that this is an issue. And if you're a young guy or even a young woman, you're at risk for developing long-term sexual dysfunction and anhedonia if you take some of these medications. And you got to weigh the risks and benefits of getting on them.
Yeah, very well said. And Imran, I would like to obviously hear from you about how PFS has impacted your life.
I got to say, it's a life changer. It completely derailed my life. So actually, when I was 31, I was recently divorced. So I had just finished my training too. So I graduated from my training in 2019. I just taken my boards, which thankfully I passed, So when I studied for my boards, I was at the mental top, I had taken a course. I knew the knowledge fairly well, and I felt really confident when I left the exam. So I was at this high, where I was about to start my whole life. And then I took this multivitamin and it completely changed my life. I started, this extreme sexual dysfunction dominated my thoughts. So, it's like suddenly all the problems that I used to have became nothing. And I just wanted to get better. For me, I wanted to have a family. I wanted to settle down. Now I'm in this position where I'm doing this interview with you. Every month I'm trying to see a new doctor. I'm like emailing researchers, like I'm telling my friends, in the hope that maybe they know somebody in their network that might have a suggestion. I try to have hope because I know that the mechanism is not known and there's very minimal research. And I think that more research and more attention hopefully will elucidate, possible treatments or, an etiology. And, hopefully we'll have a treatment in the near future. It's a tough thing though. And I also want to, address the medical community just briefly. In my job, I work with a lot of surgeons and doctors who help a lot of patients, who are in tough situations. I've seen them do great work. I have an immense respect working with these people. They go through training. They put in the dedication. So I want to preface my next statement with that fact. Okay, so I'm not trying to take away from that. But I got to say, I've seen some of the top sexual health specialists in the United States because obviously trying to get that back, it's a big deal to me. And there's a profound lack of understanding in the sexual health specialist community. So, we call ourselves andrologists and sexual health specialists, but, why do we have this lack of understanding of why these young men and even young women are getting castrated and losing their sexuality? And why is there this denialism and this attitude that, go see a therapist, which a therapist is useful, to cope with the symptoms, but we need to address the root cause. And I'm actually kind of shocked at some of these responses that I've gotten from specialists. They say that, well, we'll do the best we can and we'll try this and we'll try that. But, you'll never get back to your baseline. I've been told that. One doctor I saw, he wouldn't even shake my hand, wouldn't look me in the eyes. He didn't believe that I was an anesthesiologist. And, that's the first time I ever complained. I'm not a complainer. Okay. I grew up in a household where you get the job done. Okay. I work hard and I get the job done. And I actually called the office and I was like, look, I've never been disrespected like that in my whole life. I'm going through a tough time. I'm vulnerable. I'm coming to you at one of the lowest points in my life. And the guy actually called me a red flag. He's like, you're too young to be going through this. He's like, just take the max dose of Cialis and you'll be all right. And I'm like, this guy, I can't even relate with you, because if you're having sex every day and you're taking a max dose of a medication just to be semi-functional, I mean, that's no way to live. I want to know what are your thoughts on this syndrome, given your expertise? I mean, shouldn't you have some deeper thoughts about it? I hope that whoever's listening, who's in a position to help, people who have research labs or get grants, I want to emphasize to you that patients are self-funding studies right now. So I'm part of a fundraising group, which Eric, you have a big role in. There's like hundreds of people in there, and these are people who are barely getting by, who are donating to try to get research done. Now, there are people who work for labs in major universities who are getting these major research grants. They're in a position to really help us out and accelerate, research towards a cure. So, I just think I just really want to call out to anybody that's listening that's in a position to help. I mean, we got to take this seriously, and this could happen to your son, your niece, your nephew, your niece, anybody, any young person. And I'm telling you, it breaks my heart whenever I see a new victim. And there's only going to be more and more victims because, like I said, the way things are moving, these medications are more and more accessible to young people, and they're aggressively marketed. Same with supplements, and there's no understanding of risk. So it's something that's it's a massive public health crisis, but people are not aware of it yet. And I guarantee you, in 5 or 10 years, you're going to get a whole bunch of people who are like, man, I have severe sexual dysfunction. And then 10 years later, the research will have caught up. But in the meantime, like I said, I kind of just, I hope whoever's listening, who's in a position to help, hears kind of this issue and takes an active role.
Absolutely. Really well said, Imran. And it's my pleasure to have you on. And I really appreciate you stepping up and sharing your story with everyone. And I'm really sorry that you're experiencing this. I think that, there are a couple things that you said that I want to highlight, because I think they're very salient features of your whole experience. Just when we wrap up here, I'd like to first just remark on the fact that obviously you are a very well-credentialed medical professional who studied at a lot of top medical institutions in the United States, and you're an anesthesiologist as well. And I think that it's very interesting taking that into consideration, and the fact that you started experiencing a very broad spectrum of multi-systemic symptoms, and it took you a very long time to connect the dots to PFS. So I think for anyone who might be tempted to label this as psychosomatic or some sort of delusion, or the very typical accusations that are leveled at those who present themselves with this disease, I think that those are some things that those skeptics might want to take into consideration. The fact that it was, I think, over a year before you even connected this wide array of symptoms, which match those who have also taken saw palmetto and other substances which have the same mechanism of action, blocking the conversion of testosterone into DHT, 5-alpha reductase inhibitors. So that's the first thing that I wanted to just highlight about your experience, Imran. And also, in respect to the fundraising group, we are all supporting the PFS network, who are organizing a lot of very important research into PFS. And if you would like to support them, you can have a look at their organization, PFS Network. And I think also, just to wrap up, in respect to the first point that I was making, Imran made a very important observation, which is that all the research is self-funded. So we have people who are, very young, in some cases still in university, who are dealing with this devastating disease and who are dutifully donating on a monthly basis. So I think that that's relevant to point out, as well, to anyone who is skeptical. They'd have to ask themselves, why on earth a group of people who are especially quite impoverished and maybe don't even have steady employment, why they would be in a fundraising group supporting research on a monthly basis. So thank you so much for sharing your story with us, Imran. We really appreciate it. And thanks for your courage.
Hey, it's my pleasure to be here, man. And before I go, I want to give a quick anecdotal thing that I learned in medical school. So I want everyone who's watching this video to look up congenital 5-alpha reductase deficiency. For anybody that might be denying that this is reducing your DHT can have an effect on the body. If you look at this syndrome, it's people who are born male, so XY chromosomes, who have a deficiency of 5-alpha reductase. They're born with female genitalia. So DHT is essential in sexual development for both men and women. So for anybody that's in denial, using a drug or a supplement that blocks the conversion of testosterone to DHT, it makes sense that it would have these kind of effects. Okay, it's not out of the ordinary. So that's one thing I just wanted to mention, that I didn't mention in the interview before. So I appreciate you, Eric, man. Thanks for all your work, and it was a pleasure to be with you. Thank you.
Absolutely.